we're sharing pearls with our attendees. And my first pearl is a procedural pearl. Particularly when you biopsy patients, they tend to have some pain. And one way around that, particularly on the nose, which is a very sensitive area, is to go ahead and wiggle the nose a little bit with your non-injecting hand. It takes a little coordination and it takes a little skill, but if you can just wiggle the nose a little bit as you inject, the nerve fibers can only send the wiggle and they can't send the pain. And so the patient virtually has a pain-free experience when you're doing a biopsy on the nose. My second pearl of the day is a surgical pearl. I know many of us are doing excisions in our offices, and sometimes the vector of tension is a little bit hard to find. So there's a way in which I have found an easy way to pre-surgically identify where my ellipse is going to be cut. And you can do that by first identifying what spot needs to be removed, and then you take your two fingers, and if you can see this, you just squeeze different angles of the skin of the site. And wherever you can squeeze the easiest, wherever you can pinch the skin together the easiest, that is your vector of tension. And so then and there identifies the line in which you need to make your ellipse. However, if you're working on a shoulder or a convexity, it's problematic. And what I would recommend there is to take a surgical margin. Whatever it is that you're cutting out, there's an appropriate standard margin. So go ahead and do that, make a circle. And what will happen is because you've now made a free margin, the body's vectors of tension will pull that circle into a shape. And that is the shape in which you follow with your Burroughs triangles on either side to make your ellipse. I hope that was clear for you. It's a little difficult to explain, but I think you guys got it.